On behalf of DHR Health, welcome to our patient instructional video. In this video, we'll provide you with important information and guidance to help you better understand and manage your health. Our goal is to empower you with the knowledge and the tools that you need to take an active role in your healthcare journey. So sit back and let's get started on this educational and informative journey together. Total hip replacement is a surgery to replace part or all of a person's hip joint with a man-made artificial part. This man-made hip joint is called a prosthesis. The hip joint is called a ball and socket joint. This is a joint where the ball at the end of the thigh bone sits in a cup called the acetabulum in the pelvis. When the hip joint is healthy, the ball moves smoothly in the cup, but with injuries that happen over time or old age, the ball does not move smoothly, or the cup gives out, causing pain. Different conditions or problems can cause your hip to break down and fail. The most common is osteoarthritis, which causes wearing and tearing in the joint and is associated with age. When a person has problems with their hip, it may feel stiff, and you may feel pain in the back and down your leg, and you may have a pulling feeling in your groin. This makes it hard to move around and live your life. When you sleep, you may not want to lay on your sore side. When you walk, you may experience pain and discomfort, and this surgery is done to help you move better without pain or discomfort. Now that you've had your surgery and your hip joint has been replaced with a prosthesis, you may have an incision in front of your groin or on the side of your thigh towards your back. This may be covered with a dressing or sealed with a special surgical glue. You might have a drain in place. Some doctors use this to drain any buildup of blood or fluid, while others choose not to. It'll keep the extra pressure off your new joint. At the end of the drain is a bulb in which is squeezed, places suction on the joint. You or your caregiver may have to pull the stopper out, squeeze the bulb, and push the stopper back in to continue suction. This extra fluid will come out of the wound and fill the bulb. You or your caregiver may have to empty the bulb if it gets full. It's important to make a note of how much you empty so you can tell the doctor at the next appointment. Immediately after surgery, you may not feel any pain because anesthesia gave you a nerve block at the end of surgery, which helps with the pain. This block will last about 6 hours, and afterwards, your doctor has ordered you pain medication. Ice packs placed alongside the incision will also help with the pain. It's important to place a towel between your skin and the ice pack to prevent injury to your skin. Before going home, physical therapy will come by and help you walk with your walker. If you have your own, have your family member bring it to the hospital so that they can adjust it to your correct height. Always walk with support until you feel steady and your doctor says it's okay to either get rid of your walker or progress to a cane. Your doctor will have ordered pain medication for you when you go home. They may have ordered a blood thinner to prevent clots from forming in your leg. Usually it's just baby aspirin. You may have to take the baby aspirin from now on. They may order antibiotics if you have a drain left in place. You will need to take them according to what is on the pill bottle. Take them with food so your stomach doesn't get upset. The doctor may order a stool softener. Use it because the medication will constipate you. It'll be uncomfortable on your hip to sit on the toilet for prolonged periods. Some doctors order gabapentin to help with the nerve pain. Take as ordered. Your best friend at home will be ice packs. Use this to reduce the swelling and help with breakout pain. You will be given an appointment for physical therapy. Take a pain pill before you go to therapy so that you can handle the pain or discomfort while you're doing your exercises. Use the ice packs after therapy to help with the swelling, the stiffness, or any breakthrough pain. When at therapy, your therapist will give you home exercises. Do them because it will help you walk better and help you to walk without a walker sooner. Exercise is used to restore your normal hip movement and strengthen the muscles of your thigh. The stronger you get, the sooner you can return to normal activities. The more you walk, the better you will get and the stronger you'll get. If you have a drain or a dressing, leave it alone until you see the doctor at your first follow-up visit, which is usually sometime in the week after you've been sent home. Let the doctor remove it because you do not want to cause any type of infection in your wound. You will not be able to take a shower or a bath until the dressing and the drain are removed. Once removed, you will be able to take a shower, but no tub baths until your skin is healed. If you fall and develop intense burning pain in your lower leg, a growing lump or swelling in your hip that does not go down, thigh muscle or skin becomes hard and tight, if you're unable to walk or bright red blood comes out of your incision or drain, call your doctor immediately. They may want to see you in the office or tell you to go to the emergency room. You could be bleeding into your muscle, developing a clot in your lower leg, or could have knocked a part of your hip loose. So please, call us. We're here to help. In conclusion, we hope that this instructional video has provided you with valuable information and guidance on managing your health. And thank you for choosing DHR Health. Remember to follow the instructions given by your healthcare provider, take your medications as prescribed, and maintain a healthy lifestyle. If you have any further questions or concerns, don't hesitate to reach out to your healthcare team. Take care of yourself and stay committed to your well-being. We're here for you for life.